Okay. Can you see the presentation of Ellen's?
We can see the email with but not the actual presentation. But if you tried opening it up right there, like if.
Yeah, it's open. I'll put it on.
There you go.
There you go. Yeah, we're seeing one of your screens. So
fantastic. Okay. You can call the meeting to order whenever you're ready, and then Ellen can jump in.
Okay. I will call the meeting to order at 6:02.
I second it.
I guess we should do roll call. I'm Brian Green here.
Robert
Follow
Sixia,
the shadow
present.
here.
Excellent. The last set of minutes look great, other than the fact that my name was spell checked to Brain Green at the end, which I'm good with, but. Given that exception, I make a motion to approve the minutes.
I second it.
All in favor?
Aye.
Aye.
Okay. Helen Schachter, I believe you have the floor.
All right, thank you so much, everybody. Karen, I am just going to tell you, why don't we just advance to the next slide? You can do that for me. Thank you. So I've been asked to come here to talk a little bit about the housing situation post-moratorium. And this first slide is actually a piece of good news I just wanted to share that is during the moratorium, but I figured I'd just start with this to share it with you because I think this speaks so much, has so much to say about your willingness to really impose and keep a moratorium in place. If you look at this, just thought it was worth looking at for Somerville, which is all the way to the right. The top group is filings, and this compares us. We are the purple numbers of evictions filed. The gray is the state average. So you can see that we were just way below both the state average and our neighboring cities and towns in terms of rate of eviction. And if you look at the very bottom line, which is actually executions, this is the bottom half of this chart is actual evictions as opposed to just cases. And you can see we were almost at an effective zero level. And so I really just wanted to thank you all for your support to show you that it worked, and really, really grateful. This is part of the Cambridge Health Alliance Wellbeing Report that just came out. And so just wanted to share this with you quickly.
Ellen, quick question.
Yes.
Did those other 3 municipalities not have eviction moratoriums? Is that why?
So Malden had a moratorium, but theirs ended earlier than ours. Everett, I don't think had a moratorium. You know, everybody had the state moratorium, right, for the year that it was in place. So this actually captures a period of statewide moratorium. So actually that was in place for, trying to remember if it was when the federal moratorium lifted. Actually, the moratorium was in place. Thank you for making that correction during this whole time period for everybody. So
okay.
That actually just shows you, but in some cases it was a local moratorium being locally enforced, and in other places it was the broader state moratorium. But evictions were definitely happening over time in these other jurisdictions. So, but thank you for that. That's a good clarifying question.
Okay.
And if we move to the next slide, I'll tell you where we are now and what's happening. Post-moratorium today. So the moratorium that you guys put in place, as you know, ended in the end of June of 2022. So I looked at some periods to compare. July 1st to November 15th period. You can see there were a total of 58 evictions filed. I do want to say 2 things. It's an average of about 10 a month. Well less than our neighboring towns of similar size. And as you'll see, I compare them below. 10 a month is actually significantly less still than it was pre-pandemic. If you look at the bottom right-hand corner here, I just put in a pre-pandemic year as a comparison point. So before the pandemic, we were averaging around 17 evictions. And these are non-payment evictions. There's a few others that are not non-payment, but about 17 per month. During April 2021 to June 2021, which was at the height of the moratorium. In Somerville, there were an average of 5 per month. And in the 3 months before we ended our local moratorium, there were about 8 per month. So I think the news is they're creeping back up. They are still significantly behind where they were. And again, I really do look at several factors in that continued success. One is the ability of local and state rental assistance resources that were not available before. Give some credit to my office for having an Office of Housing Stability in place, having contracts with lawyers, and having contracts with tenant organizers. So it's creeping up again, but we're doing significantly better than pre-pandemic. Obviously, each eviction is one too many, so I don't say that to say that it's okay. What I will say, just so you know, and I think you all know this, is the top number here, this 58 total, is the number filed. In the same period, there were 29 executions. So those 29 executions means that the court issued an order which could allow a physical eviction. Upon information and belief, I will say I don't have a way to know exactly how many of these were executed on and people moved out, but it is a far lower number than that. These executions represent cases of default. They represent cases where, let's say, a landlord won, but we were able to come up with rental assistance and work them out so they didn't have to leave. So I would say that the actual numbers of people displaced are lower than this data would suggest. But nonetheless, I think it's important data to see. And next slide, please. So what's been going on post-moratorium? Where are we now? What additional resources or interventions have we put in place? I think you guys know from the last reports, the ERAP program, which was the state rental assistance program, allowing up to 18 months of rent during the pandemic period, ended on April 15th, 2022. But since that time, we started a new program called the Flex ARPA program, which was funded with $1 million of flexible funding for rental arrears, but also to help people with up to 6 months of prospective rent. This is an unprecedented kind of program locally, and you guys are the first to know, hot off the press, we were just approved for an additional $3.4 million today. So we are going to have a significant additional infusion into this program, which is really lucky because I just wanted to point this out. The Community Action Agency of Somerville and the Homeless Coalition each got $500,000 for this program. CAS had committed essentially all its funds within 2 months. So that can tell you that there is still an extraordinary need. What that's also reflective of is that it doesn't just pay arrears, but they make commitments to pay 6 months prospective, with tenants paying a portion. But so they have, it represents a future commitment, but certainly a good deal of stability for many of these tenants, and for those that have to relocate, a good period of time to really find other housing. So the money went really quickly. You can see the wait list still here. There were about 70 people still on CAS's wait list when they had obligated almost all of their money. SHC had obligated less, but they had 127 families on their wait list. So the demand is really high. I will say, though, with this new infusion of funds, this was the amount that each agency thought they could reasonably expend in the best case scenario. So I would say the program is fully funded for whatever that means right now. And I'm really grateful to that because I was very worried about it. Other things that we've done to try to put more resources in place, we doubled our legal services contract with De Novo. So as of December 1st, we have essentially 2 FTE attorneys instead of 1 working on cases. And we also doubled our tenant organizing capacity, which is so important because of a really high rate of building sales. I think we had talked about this a little bit before, but if you were to say to me now, what's the most destabilizing thing to our most marginalized communities? It's building sales and the pressures of markets to turn over to mostly LLCs who are seeking to maximize their quick income from the sales of property. So that organizing capacity is a really important piece. We are trying very hard to keep some of these buildings and get them into nonprofit hands and off the market so we can stabilize people in place. So that is the goal of the organizing capacity. And yeah, and then next slide, please. Just wanted to show you a little bit about where service requests were during this post-moratorium period and who we have been serving. as you can see here, we had about, in this period since the moratorium, 527 requests for services at a rate of around 117 requests a month. This is a pretty stable rate, and fortunately or unfortunately, it's not showing a lot of decrease before or after the moratorium. There are a similar number of people who are in need, but obviously at different stages with different amount of urgency for those cases. One good thing I wanted to tell you guys about is a policy change that we have negotiated with the Somerville Housing Authority, just because I think it's important and interesting. That it used to be for public housing, in order to get to the top of the list as an emergency. Whoops, somehow the screen just went away for me. Did it go away for you guys too? Okay, just wondering.
Yeah, we lost it too.
Yeah, same thing.
Well, while Karen's trying to get it on, I'll continue to go through this slide with you guys. So one really positive development was that it used to be to get somebody to be considered an emergency for federal housing, to skip to the top of the list and have any hope of being able to be stabilized if they're being displaced. We used to have a whole eviction process with a judgment, and this was incredibly scary, intimidating, no guarantees the person would get housing by the time they had to leave. And we've now negotiated a new policy whereby we can certify if somebody has a notice to quit or they're in that beginning stages, the landlord can certify that it is their intent to displace them within 6 months, and we can actually now potentially get them emergency status to jump to the top of that list if they're being evicted without them having to actually have an eviction judgment against them that's immediately going to be executed on. So that's a policy change that I think is going to make a real difference in terms of practice, and especially for immigrants and undocumented immigrants. That process of going through eviction is incredibly difficult, stressful, and puts a lot of pressure on mental health and physical health. And this is, I think, a really good change. And then in terms of vulnerable populations, we just looked at this statistic finally, and since OHS is opened, 43.5% of our clients speak a language other than English. And I think that's a pretty extraordinary rate. Really says that, and you'll see why later, we're focusing some of our programs and outreach around the immigrant community, because there has been such a disparate impact from housing crisis generally, from COVID, on our immigrant population, and the numbers just continue to be really, really high. The percentages of non-English speakers that are coming and seeking OHS services to try to stabilize in the community. And I also think that this has increased because of newcomers also coming. It's been, as you know, splashed all over the news. There have been some number of Venezuelan, Colombian, and other families coming into the city of Somerville. Without a lot of resources and in very housing unstable, overcrowded situations. So that is a piece of the population that we've really been seeing at OHS. And then I would say that in terms of our volume of applications, it's similar to what it's been. We've had about 300 rental assistance case requests in 2022. It's about as similar to prior levels. And at this point, we've calculated that our staff, OHS staff working with tenants, have now brought in just around $5 million in rental assistance during the COVID period. So that number is still going forward. It's harder now that ERAP isn't in place, even with local resources. The ERAP program was really easy to access, was an 18-month program, and it's harder. It's more difficult for people to get off waiting lists and get help with rental assistance, even though the money is available in most cases right now. So, and then next slide. So what is next? I just gave the bottom line of my first piece here that I was waiting for a decision on this $3.4 million, which I did get approved today. The second thing I had mentioned this, I think, to you guys in the past, but I've been really trying to develop something called a municipal voucher program, which is a locally funded deep subsidy, like a Section 8 subsidy, but there wouldn't be federal or state restrictions on it. It would be something we could control to make it work in the local market. And right now it is our intent. We are drafting an RFP trying to find bidders to actually administer this program, but the intent is that it would be a priority for families not eligible for federal housing. So that is immigrants that are legally here with temporary status, and that's some undocumented families that have kids in the public schools. So we will be working closely with the school department. They are very anxious to see this happen and going forward, and this is meant to be a permanent program. And I did want to just say, for this municipal voucher program, there are some other municipal voucher programs in the state, but it would be the first that would have this kind of goal and this kind of target. And we just on Thursday got approved for $1.8 million in funding from the Affordable Housing Trust Fund, and all together with ARPA and other commitments now, we have about $5.8 million for the first 5-year phase of this program. So really exciting. And I think an important, really important for the health of particularly our most vulnerable communities. The two other things of importance, new early acquisition funding. You may or may not have heard the mayor gave about $8.3 million into the trust fund that is new, and it's a special kind of fund that really allows people to buy up properties. So when I was talking to you about that building organizing and these building sales leading to displacement, this is another piece of the puzzle in terms of giving nonprofits the tool to keep housing off of the speculative market. And so I think this is going to be a really good opportunity. One of the buildings today that we were working on might take advantage of this early acquisition fund. And it's a unit where there's now 6 evictions happening, all immigrants, all long-term immigrants, many multi-decade. And then the last thing I would just tell you about is we are starting a temporary hotel stay program. And I think the thing that would be most relevant for you guys here is you know, there's never really been a system when the Board of Health issues an order for tenants to vacate, or when there's a fire, or when there's sort of emergencies that come up. There really has not been a comprehensive system of what happens. And you know, the city now hired an emergency preparedness person. I don't know if you guys have met with Justin yet, but this really forced us, we weren't anticipating, there were 3 buildings with fires. I don't know if you guys have heard about that, but 3 large buildings with fires over the last several months, 2 of which were low income, had a lot of subsidized units in it. So it really brought, I think, both to HHS, to Karen's team and my team, the real need to look at this more closely. So we are designing a temporary 7-day hotel program for certain kinds of emergencies, which I think will be another help in the overall fabric of keeping people housed in health, especially when there's temporary disruptions and they have absolutely nowhere to go. And the last thing I would say about this, I don't know if you have all seen, I think I might have sent this, but the new draft state sanitary code that was released by the state and is going to be implemented in April of 2023. I actually worked on it 10 years ago in legal services, so it's been a long time in coming, this revision of the sanitary code. But the really good news along these same lines, just in terms of emergencies that arise, are that for the first time ever, the state sanitary code will specifically state that an owner is required to put tenants in alternate accommodations if there is an order to vacate by the Board of Health or ISD. And that is something that legal services had tried to get for tenants and sometimes was successful in doing and sometimes wasn't. And this really will put that in place so that there is an actionable item to help us make sure that people are housed when these kind of emergencies come up. And then on the next slide, and then I'll see if you guys have any questions, is just, okay, so what's our big concern? Where am I? You know, we've put a lot of great things in place and we have ARPA funding for a lot of it. And that funding ends at the end of, our use of that funding ends at the end of 2024. So if you were to ask me what the biggest challenge is that relates to housing and health insecurity and, health impacts of housing instability, I would say figuring out how we're going to stabilize some of these programs and what the city's priorities are and funding opportunities are once the ARPA money goes away, and we have to figure out which programs we're going to be able to keep and which we won't. So that would be my final note on all of this, and happy to answer any questions if any of you guys have any questions.
I mean, go ahead, Brian.
Yeah, first of all, I just want to say there's lots of really fabulous stuff in here, and I really appreciate all the hard work you're doing. I think, you know, it was lovely that you gave us credit for the eviction moratorium doing all that terrific work, but I think what we have that Malden and the other cities you put up doesn't have is you and your office. So I really just want to say thank you for the terrific work you guys are doing to keep people in Somerville housed, and the forward thinking. I think it's great.
And I just wanted to say one thing to help you too, just Karen and Brian, especially you, but to the whole Board of Health. You guys really, really quickly stepped in and wrote a letter of support for the municipal voucher program. And I just wanted to really thank you for your quick action on that. I really think it makes a difference when we're with a united voice around this. So I forgot to say that part and wanted to just add that in as well. So thank you.
Yeah, I'll echo similar compliments that Brian gave. You know, we're here, we give the up or down, but I think what really matters is having, a dedicated, thoughtful, you know, and really, you know, resourceful city staff. And so, Ellen, you know, all credit goes to you. We're just kind of like, you know, high level issue spotters at the finish line. So yeah, thanks for all that you've done. I think I just have a few kind of quick questions for my own continued, you know, edification. The funding is through 2024, and so 2025 is really like, that's the kind of unknown. So for the short term and medium-ish term, you know, it sounds like we're good for a few years, but, you know, we just need to see how the landscape is, you know, the following year for 2025. Is that right?
Yeah, that's exactly right. And I mean, ARPA, just so you know, ARPA funds are technically allowed to be expended through 2026, but we have gotten a decision from our own consultants that certain things are fundable for that long period and others not, and that we have to wrap down any ARPA funded programs by the end of 2024. So that was a little bit of a surprise to me and a change. So we've had to kind of recalibrate some of our thinking. But yes, so that's 2025 is really the period where we won't have the same access to resources that we have had during COVID.
Yeah, fair enough. Well, I think, you know, we take what we can get right now and, you know, try to forecast future avenues of funding, you know, next year for 2 years from now or whenever the appropriate time may be. But yeah, though, this is excellent news, Ellen. I think just so I kind of have the key bullet points from your presentation. So it sounds like following the lapse of the eviction moratorium, which was this summer, I recall, it sounds like the evictions filed as well as the evictions executed, they're a little bit lower than the pre-COVID numbers. Is that accurate?
They're significantly lower. I mean, they were about 17 per month pre-COVID, and now they're at about 10 per month. So I don't know, 60% of what they were pre-COVID. And there also was a lot of amped up stress on the system, right? So we also had a clump of filings right at the end of the moratorium, right after. So I'm cautiously optimistic that with the resources we have in place, we'll, you know, at least not go back up to where we were, and hopefully continue to decrease the number of actual evictions that are happening. But yeah, so I'd say we're at about 60% of where we were, even though our numbers are much lower than other cities or towns, you know, across the state, the numbers are still a little bit lower than pre-pandemic. I think as you see the rental assistance capping out, you're going to see that number for many parts of the state going back up. If we didn't have this Flex ARPA fund, we would also be seeing our numbers going back up. So I think a lot of pressures on localities to figure out how to fill in the gap. Yeah.
Okay, so
but it sounds like.
Oh, go ahead, Brian.
Sorry, it just sounds like. I mean, one theory was that the eviction moratorium would have ended and then there would have been this pent up demand and we would have had, you know, double what we had pre-pandemic. So that it sounds like the funds that we've been using and the Flex ARPA program and all of that has been not just holding back this, you know, eventual set of evictions, but actually decreasing the overall need to go to evictions in the first place.
That's
considerable.
absolutely true. And sadly, there are the policies in place are now that in order to get access to rental assistance, you often have to get a notice to quit. And that is not a great situation, especially for, mental health and and for landlords who don't do it too, to be honest. So that's something we're working with and may be changed at the legislature on the state side for the state rental assistance program, but we continue to advocate to change that rule. But oftentimes they will now file the notice to quit, but not proceed to court because we can resolve the situation while that notice to quit is pending.
Okay.
But it does seem like keeping this data and showing how successful these programs are,
Absolutely.
is what's going to help us fend this in the future, right? Because if we can
Absolutely.
demonstrate efficacy, then.
Absolutely. Yeah.
I think, yeah, what might be frightening is the cliff effect after, assuming no future funding, right? Because we have this kind of pressure with all the funding that's really keeping, the volume down. But granted, you pointed out some nuance that now certain assistance might not be available until you get your notice to quit. So yeah, no, really interesting point. So yeah, we'll keep a lookout on this. And just one last, this is like a super small point for me, just continued learning. So Somerville's looking to supplement like emergent acute housing needs with hotel. I thought the state offered that. No, is it?
So really good question. Really.
The gap?
Yeah, that's a great question. So what the state does, because that's one of the things our office does a lot of, is helping families to access state emergency shelter. So you can get emergency shelter through the state, but you have to meet immigration requirements, and you also have really low income limits, like really low, 115% of poverty. And then that state shelter, right, that's for families with kids under 21. So the big gaps are, we will not provide a hotel for anyone who's EA eligible. We'll provide a hotel for up to 7 days and then transition them into emergency assistance shelter. It often takes time to actually get somebody into state shelter. So that is often our trajectory for families. We place them temporarily as we're going through that system. But sadly, there's also a lot of families in Massachusetts who are not eligible for that shelter. In the newspaper, you will see it being a right called a right to shelter, a guaranteed right to shelter. Really a misnomer because of the very, very, very low income limits. So any family that has 2 working parents is going to be ineligible for shelter, basically. And any family that has 1 wage earner that is doing reasonably well will not be eligible for shelter. So, and this program isn't meant to replace that. That's long-term shelter. This is a very short-term program, but it is something that we are using to buy the time to get people into those shelter programs.
Okay, no, that was really helpful and clearly, yeah, answered my question on what it was trying to address. And yeah, it's essentially there's a huge eligibility gap in who's eligible for the assistance and then who actually needs it. So no, thank you for that, Ellen. I think long term it'd be great to just connect with you maybe every half year or whenever you just see fit,
Yeah.
because I think this was a component that, at least during my tenure of the board, only came up really during COVID. But, as we know, housing, especially in Somerville, a city that's mostly renters, is really critical. So, if your willingness to meet with us again in 6 months, just to kind of check in and talk, I really enjoy seeing how things are going with your office.
Thank you. I'm happy to do that. And just to let you know, I do have a Master's of Public Health student that is going to be working with me. So may be in touch with you about the social determinants of health, and particularly housing and immigrants in the city of Somerville. So I may ask you to share your wisdom and chat with her at some point because she'll be coming on board soon. So yes, I'd be happy to come back and talk with you in 6 months. And thank you for your support.
Yeah, of course.
All right. I will, unless there's any other questions, I will sign out. So thank you so much. I appreciate it.
Thank you, Ellen.
All right, moving on. COVID updates is next on the agenda.
Okay, we are currently offering weekly booster clinics here in the annex through the end of November. The staff have done a number of clinic sites around, including a large clinic, a regional clinic at Tufts on the 5th of November that went real well, 550 people or so, many Tufts students, so that was great. And then we review data every other week with Somerset. That's been an ongoing thing. And again, one of the key areas of health disparity and concern are seniors, hospitalized seniors at this point, due to flu, RSV, anything else, COVID as well. So we've met with our partner, our senior serving agencies, and did some brainstorming about where the needs are, where the coverage is. And we are working with a couple of senior buildings nearby to support ongoing residents with getting COVID shots, boosters, and flu. So I think that's kind of the COVID update. We still have plenty of test kits. The numbers in general are fairly steady at the moment, and the wastewater and hospitalization has declined. So kind of, watching it, but in an okay spot. There's been a lot of information out from the state around the respiratory viruses and those concerns, pressure on hospitals, all of that. So I know the state is working hard on that issue with healthcare providers directly and watching as well. So we're just kind of helping be a conduit to get that information out. I think that's it.
Yeah, I think, my only thoughts on COVID is, and not many people attending our meetings now. I think we're back to our usual audience, but I think to the extent this gets relayed, obviously, vaccination to prevent serious illness. I think also messaging hopefully remains consistent about the use of high quality masks over cloth or surgical masks. I think that should probably be a new nuance that, people get used to. And in the event that there is a winter surge, I think it'd be good for people to understand there's a big difference with masking. Agreed, Karen, about the concerns with staffing, beds, pediatric beds with, I think the three, respiratory diseases that are going around right now. And hopefully we'll hit a wall soon, and one or maybe all of them can take a dip. So
I am a little concerned. We have such impressive respiratory illnesses traveling around right now, and we have Thanksgiving coming up, and there's going to be a lot of people sitting around the tables. And I can say, just from the clinical perspective, we've been hearing, clinic after clinic that is having difficulty staffing because people are out sick.
yeah, I mean, it's that and staffing shortages, right? And COVID, all that massive, like, generational retirement. And then, Brian, people with acute illness just, not being able to come in too. Yeah, it's putting a lot of pressure on the system right now.
Yeah.
So, and, hopefully people will be pragmatic and not see their families if they're feeling symptomatic, test. And can I mirror just, not mirror, just reflect some thoughts on testing. I think we've gone from, like, kind of a high standard with PCR, granted a little bit of a latency with days in getting our results, to now, I guess, the convenient, the cheap antigen testings, but a much lower sensitivity, especially with a virus that people aren't going to test if they feel symptomatic, and they're most likely spreading it before they're symptomatic. So part of me just raises this issue of, like, this pivot to antigen testing. And then, I continue just to voice thoughts of uncertainty if that's going to be a long-term effective strategy in mitigating COVID. We know that improving mask quality, that will certainly help. The other tool, testing, though, I feel that at the cost of convenience, you know, there is a lower sensitivity in actually determining that you are, you know, positive or negative. So anyways, I just have to reflect some thoughts there. So I don't know what the solution is there. It's obviously bigger than our small panel here. So.
I hear you. All right. Any other comments? Paula, anything you want to say?
No, I was trying to add her in earlier and then you guys said everything too with Ellen. As far as COVID and all the diseases, I feel like this isn't sounding that pessimistic either, but like it's some people who are asymptomatic, you don't test, so you end up spreading it. Like you said, it's going to be hard to manage for a while. I feel like, I don't know.
My editorial comment is if you're going to visit relatives or friends or anyone who is not your normal pod this next week, then please test before you go.
Karen, just one thing we spoke a little bit about the COVID or the vaccine clinics. Was that for COVID boost, the bivalent booster, or was that for flu or both? Because I've read there's a higher but not a great uptake in the COVID bivalent vaccine, and there's a much lower uptake with the annual seasonal flu vaccine. So just wanted to understand a little bit more about what you were describing with the flu campaign. Was it for COVID or flu or both?
Both. The hospitalizations for the senior population at this point are largely flu and other respiratory. So that's where we decided we needed to focus, but in anticipation of, you know, COVID could hit as well this winter. So we've been trying to ensure that there was good access for our council on aging, our home visiting folks, a number of different strategies to just make sure that there was information provided to people about the booster, why it's important, and then the flu as well. So it was kind of a combination of really targeting both.
Okay, thank you.
And you're correct that the COVID booster rates are nowhere near where we'd like to see them for any age group. Yeah.
Yeah, and I think flu is even lower than that as well. Yeah, it was, I'd say, pretty pathetic last I looked at it, which is disappointing because flu trajectory is, I mean, I'm even trying to convince some people in my, you know, secondary family to get it, and it's a lot of advocacy. I'm hoping to get there though, through emotional appeal. So I can't do it with logic, so I got to use emotion next.
Yeah. Mm-hmm.
All right. Health and Human Services updates.
A couple of quick updates. The Veterans Services Department hosted a wonderful event last Friday at Assembly Square. It was a Veterans Memorial event with speakers, music, as well as hosting the exhibit of a replica of the Vietnam Memorial Monument, if you know, set up down in Assembly Square in the garden, which was beautiful. It was quite a production. I think we didn't realize what a production it was until it had all happened smoothly. But it was also done in conjunction with Medford, which was nice to see a regional kind of partnership like that. We had the two mayors, the two veterans directors from the communities, and the veterans from both communities. So it was a wonderful event. It went really well, and it was a huge accomplishment that our very small veterans department pulled off pretty much on their own. So that was great. Our council on aging folks are busy filling up their staff. They hired a fitness coordinator now. They're restarting their programs. They've been back doing field trips this fall in person, which the seniors very much wanted to be able to get those going again. Our director attended the Mass Council on Aging conference, and their ARPA-funded technology program has moved forward for the purchasing of Chromebooks, iPads, and some training. So that is underway this month, and they're excited. Prevention efforts, we will be coming back to you in the next month or so with some proposed updates to our smoke-free workplace regs. We had a National Prescription Take-Back Day in October. They're continuing to offer Narcan training throughout the community, as well as free fentanyl strips. The prevention folks, in conjunction with the school, last week offered a Let's Talk workshop for parents of young adults and adolescents on how to talk to your kids about a range of issues. And they had sort of hoped for 50 or 60 people, and they had over 350 attendees. So clearly a big need there, and that was an outstanding event where a nice partnership again with the schools. It's prompted a lot of discussion about YRBS data and youth mental health. So there'll be some follow-up steps there, including the presentation is scheduled for the school committee of the YRBS data in early December, I believe, is when that's happening. They will also be hosting a data share back and discussion next Thursday night from their Mass Call grant and the sort of data collection that's happened in the first phase of that. That's also a regional grant. And let's see, I talked about Narcan and backpacks. They're assembling and distributing the backpacks to the Somerville Homeless Coalition. They contain Narcan and several items for staying warm in the winter. There are also several groups and efforts happening right now through the mayor's office and the emergency manager, Justin, to bring together agencies to make sure we have some plans in place for persons experiencing homelessness in extreme weather conditions. So right now we have some overnight sheltering that closes in the morning, so we don't have a plan for on extremely cold days where we can offer residents. So there will be the new community engagement center that the city has funded through ARPA funds, and that is getting ready to open. Hopefully in the next month or so, they'll be moving from their existing space, and then their current space will be made into this engagement center. So that will be fantastic Monday to Friday to have that as an option for people to come in, get warm, and there'll be a range of services offered there. So we're very excited, and we'll let you know when the opening will be for that. So going to our food, our OFAC team had over 1,600 transactions at their seasonal mobile markets and a net sales of nearly $15,000 worth of produce. This is just the farmers market, mobile market that the city runs. We're working on the SNAP match and the SNAP gap that we've identified, and through the needs assessment that CHA did, we can see that our SNAP gap is significantly higher than other towns. So in other words, the number of people that are eligible compared to the number who are enrolled. So we're gonna really kind of focus on that and see if we can find ways to increase the enrollment of eligible families and individuals onto the SNAP program. They're working on a map for the safe routes to school, and there's an internal task force set up. I think I talked about the nursing efforts. Ongoing hiring is still underway. I think we're down to maybe 5 or 6 positions of our 17 vacancies left to fill. So that's been a huge undertaking on the staff's part, the managers and our HR department, but we have some fantastic new folks coming. And you are right, Dr. Green, I promised you would meet Kelly tonight. Kelly Hyland is our new Deputy Director of Public Health. She is unfortunately out sick today. So a lot of stuff going around even within the city, a lot of illness and absenteeism. So we'll bring her next month to come and meet the team, but she's settling in great and really working to work on our vaccine efforts, our outreach, our prevention efforts, and getting to know the city and the team. We're also doing some training for other city departments, including mandated reporting training, Narcan training, and there's one other I'm forgetting. And we're working with the Parks and Recreation Department on the teen center the teen center space that's been set up at Edgerly School. So, and again, there's a larger process going on around a more permanent teen space, but for the moment, that's what we have. And the DPW department, Parks and Rec, are doing a great job keeping that going so that there is something, and the HHS staff are trying to support those efforts. So there's lots going on, but I don't want to take too much more time. I can also say that we are working on professional development goals, and there were 4 of us who were able to attend the APHA, American Public Health Association conference in Boston last week. It's a fantastic national conference, and so we were super lucky this year. It was here, which makes it a lot easier for us to get 4 people from our staff there. So there was a lot of great learning that happened at our leadership meeting on Monday. People brought back things and ideas and shared and started discussions, and we always like to see that happen. So I'll stop, and if there are specific questions or things you want to know about, let me know. Yeah. Just to let you know, in January, one of the things I've discovered in reviewing what we're supposed to be doing, regs, all of that, is that we're supposed to be doing an annual report, which probably happened pre-COVID or way back. But anyway, we'll combine that to address some of our goals and the progress on our goals. So I feel like that's a good mid-year January event, and we'll combine that with our annual report of some of the work that's been done. And also Nick from ISD, Nick will come over by himself, maybe with some of the members of his team, to share some of their data as well and to meet the board. So we are working really closely with them on a range of issues, and that's been great as well. That's it for now.
Thank you.
Thanks.
Thank you, Karen.
We don't need to spend a lot of time on this, but I just as a side thing to float out, I know that we always used to meet in person, and then with COVID, we were never meeting in person, and then there was a question about how long we were going to do this. And so when it comes to meeting all the new staff and even meeting you in the same room, like at some point, I don't know when that is going to be a thing.
I know, I would actually like that myself, especially since I mean, I can't get on my screen.
Yeah, I think I agree. If it's possible, I think there's some value too. Granted, not a lot of people appear to be attending, but the extent that we could still retain the remote feature for the public to attend remotely, I think that's valuable. So yeah, I'm in favor of meeting in person, and if we can still retain the broadcast.
Yeah, I mean, at least if we do it once in a while, I mean, I think it's good to do.
Yeah. And I think like we would all need it
after the Thanksgiving, Christmas, COVID, RSV, flu thing. So I'm happy to wait until March, but
Yeah, and then the weather too. That sounds actually good.
All right, March, we'll pencil March. How about that?
All right.
Good. And I will ask the city which rooms are set up for the hybrid capacity, because I think that is a special sort of IT issue as well. So I'll do some background on that and find out.
Okay,
In the meantime.
great.
All right, next meeting December 15th.
All right, sounds good.
No other issues. It's 6:51. I call this meeting to adjourn.
I second it.
Thank you, guys.
All right,
Have a good
thanks,
night.
guys.
Happy
You too.
Thanksgiving. See you
All
right,
next
take care.
month.
Bye-bye.
Okay,
Here, guys.
take care.